Evening, everybody. Welcome. I hope all are here. Yes, Dr. Mahesh sir, namaste. Thank you so much
Yes,
for
yes.
joining us.
Good
As
afternoon.
usual, Dr. Burande Saab is really prompt personality, and it shows the highest level of professionalism, which is what every learner is watching today. Dr. Ravindra sir is also there. Thank you so much, sir, for welcome to the show, and also Dr. Kaushik Devraju. So, without much further ado, although I have got around 30 seconds left more, I think I will start the onboarding process. So, very warm welcome to all attendees so that we will stabilize in about 7 8 minutes. So, the National Pharmacy Week 2020 special is here, where the focus will be on pharmaceutical care challenges and opportunities. We have none other than Dr. Burande Saab, who is the best batsman you can get on this subject. He will be representing his thoughts, views, and knowledge on that. We also have Dr. Sadanand Gowda sir in absentia. I am very sorry to say that and disappoint some of our attendees because you are aware Dr. Sadanand Gowda sir has got COVID-19, unfortunately. So he will not be in actual presence here. And a message from him will be read by the RR College of Pharmacy team. The Indian Pharmaceutical Association, IPA, the oldest body and the most important body headed by a very dynamic national president, Dr. T.V. Narayana sir, has contributed to popularization of the pharmaceutical sciences. And yes, why do we celebrate NPW, National Pharmacy Week? It is to inspire each other. So many fantastic things in R&D and other fields of pharmacy keep happening. For example, in 2015, we had the world's first 3D printed drug, and it was an amazing move when FDA approved that. It was for the treatment of epilepsy. The company's zip dose technology enabled the delivery of high drug load up to 1000 milligrams in a single dose, and the software was able to tweak doses to the individual patient. The very unique structure of this pill not only allowed it to be printed, but also provide a relief for the seizure sufferers who are often prescribed large, hard to swallow pills. So, this 3D printed technology has been used for medical devices earlier, but now it is slowly entering into the pharmaceutical field also. The Indian Pharmaceutical Association, founded in 1939, is the oldest premier association with a member base of over 30,000 people. And the IPA operates with several local branches, as well as there are at least 20 state branches. So it reaches out to the community pharmacists. You got all other pharmaceutical professionals represented in this particular sphere. IPA is the member of DTAB also, which is a very important body that advises the government on professional matters. And IPA is also associated with FIP, FAPA, CPA, and many other bodies. IPA makes representations to the authorities on matters of professional interest, and its major objective is to position pharmacists as one of the most important healthcare providers. And no wonder Dr. T.V. Narayana sir is endeavoring hard. This is the time, friends, for us to read interesting books. I found a very interesting website here. You could go there and log in and get some of the best pharmaceutical books to update your knowledge. And of course, we'll be sharing you some information about the recent launches, which includes Dr. Girish Pai's book, which you ought to read, which is on pharmaceutical complaints. National Pharmacy Week, which is observed or celebrated during the third week of November every year, has one annual theme. And this is done to promote the profession of pharmacy. And we observe that the stakeholders such as patients, healthcare professionals, state and central governments, regulators, and others who are not aware become more aware about the pharmacy profession through this National Pharmacy Week celebrations that can be carried out through the entire year, starting from that week in the November. So this time the chosen theme is pharmacists, the frontline healthcare professionals, and it is done to thank all the pharmacists and pharmacy sector people who are working tirelessly in the time of great uncertainty to take on not only the regular responsibilities, but also that related to COVID 19. And pharmacists, being frontline workers, are relieving the burden of doctors, nurses, and hospital, becoming a valuable team player. So this year's theme, pharmacists frontline health professionals, healthcare professionals, is done basically so that everybody in the society understands the role of pharmacists, not only in the pandemic management, but also as researchers, manufacturers, and those in the supply chain. So the highlight is that the role of pharmacist is not only dispensing medicines, but also is a counselor for medicines and their responsible use. So NPW states we should widen our areas of activities and advocacy. We have to work collaboratively with other healthcare professionals and associations too. So you can go to consumer organizations, government authorities, and represent what pharmacies and pharmacists do. We should engage with all the media, electronic, print, healthcare professionals, their associations, and also the chemist associations. We should indulge in the posters, stickers, banners, holdings, SMS messages, and so on to reiterate the importance of professional pharmacists. And yes, lot of interesting activities have been taken by IPA. So please be a part of that moment because IPA believes pranipatena, which means surrendering. And after surrendering, we should have pariprasnena through the humble spirit of inquiry, scientific temper, and sevaya, that is the work service which we offer as pharmacists. So this is how we are operating with this motto. And IPA, the national professional body, is definitely having a wonderful vision to promote all facets of pharmacy and improve the image of pharmacists as healthcare professionals, sensitize the community, government, and others on vital professional issues, and support the pharmaceutical activities. They undertake a lot of scientific and technical research, training aspects, and also publish journals, magazines. So be a part of this IPA and ensure that you get the monthly newsletter, Pharma Professional. Yes, Pharma Times is also a very popular monthly news magazine, and you can also subscribe for Indian Journal of Pharmaceutical Sciences. A lot of fellowships and awards are also offered, such as the Professor M.L. Khorana Memorial Award. And Pharma Times is one of the important publications, including the Drug Information Center Bulletin. There is a very dynamic office bearer community there waiting to serve all pharmacists. So right from 1962, when pharmacy as a career was the NPW theme, right down to 2020, we have pharmacists as frontline health professionals as the theme for National Pharmacy Week celebrations. So please be a part of this movement. And we are aware that when we speak, with every spoken word, not less than 2.5 microscopic droplets of saliva are uttered. That is why we say, don't touch men, that is, mouth, eyes, and nose, because that causes the transmission of COVID 19. Here is an interesting joke. A guy asks a lady sitting next to him, what is the nice perfume which you are wearing? I want to buy one for my wife. Then she says, no, I will not tell you, and don't give it to her because some idiot will ask and talk to that lady. So, what she is trying to say is, you please keep quiet. Now, why I gave you this joke is, please understand, just like how the perfume molecules can go in, so can the viral molecules also. Virus is also a very, very contagious disease which we are having, COVID 19, in our midst. So, guard against the spread of the infections and support. Now let us go ahead for the quick inquisitive. Please type the answers in the chat box. The first question, I will ask around 4 or 5 questions. What is the other name of norepinephrine? Please type the answer to this. It's a very simple sitter question for all the pharmacists. And those who are answering more number of questions fast will get a gift hamper from Group Pharmaceuticals. So what is the other name for norepinephrine? I'm not seeing any answer. Please start typing. Please type in the chat box. Yes, noradrenaline. Okay, Amog. Right. Amog has answered. Now let's go to the next question. It'll go on getting little tougher. Which is the newest vaccine technology being used for producing the COVID-19 vaccine? So which is this new technology that is being used for producing the COVID-19 vaccine? If you have watched the video, then you will get an idea of it. What is the newest vaccine technology? Can you mention the name of that technology? Amog? Yes, Veena, I'm seeing you, but what about the answer to the next question? Venika has also answered. Yes, the next question, please answer for that. Which is the newest vaccine technology being used for producing COVID 19? Yes, Varsha has answered. It is the mRNA. Okay, Varsha. Vedika has also answered too. Okay, fine, very good. Okay, let us go to the next question. Name the glucocorticoid steroid useful in COVID 19 management. Name the glucocorticoid steroid which is useful in COVID 19 management. Can you answer this question? Name the glucocorticoid steroid which is used for COVID 19 management. Let us see if you are sharp enough to immediately grasp the point. Which is that drug? Name the glucocorticoid steroid useful in COVID 19 management. Yes, Venika, you have answered two. Let us see if you can answer one more. You are the highest right now. Okay, Nandita has got it. It is dexamethasone. Thank you. Nandita has got it. It is dexamethasone. Accepted. Dr. Girish Pai is also there. Yes, Tulsi Babu sir. Very nice. Okay, let's go to the next question. Name the number one pharmaceutical company of Indian domestic market. Very easy question. Very easy question. Name the number one pharmaceutical company of Indian domestic market. Anybody? Type the answer. Number one pharmaceutical company of Indian pharmaceutical domestic market. Yes, dexamethasone is over. Sun Pharma. Amog, you got two correct. Very nice. Amog has got two correct and Venika has also got two correct. Now let us see the other one. What is Schedule HX of Drugs and Cosmetics Act? What is Schedule HX of Drugs and Cosmetics Act? Can I have the answer? Schedule HX. What is it for? Schedule HX. Ramesh, you're off the mark. Okay. What is Schedule HX? Please type the answer. This is a new concept which has come in recently. What is Schedule HX of Drugs and Cosmetics Act? Schedule HX. Can I see the answers coming in place? People are struggling. Yes, Varsha, it is wrong. GSK is off the mark. Now, that is the old question. What is Schedule HX of Drugs and Cosmetics Act? If you have been seeing the various trends in pharmaceutical field, you will be knowing what is Schedule HX. No, not prescription of drugs. Venika, you are wrong. Try. Let's see who will give the answer. What is Schedule HX? Yes, Schedule HX. You should be knowing this if you are following. No, it is not prescription drugs alone. What is Schedule HX? There is some burning problem today in the society. It is related to that. Schedule HX. Pharmacists, you should be updated. What is Schedule HX? No, not narcotics. Not narcotics. Not narcotics. No, not chemical name in labels. No. Let us see. Anybody else will be able to answer. Schedule HX. It is something related to resistance. Okay, that's all I will tell. Something related to resistance. Schedule HX. Yes. No, not Venika. Which it relates to, yes, misuse of antibiotics. Sanjeev, you got two correct again. I'm watching you. Sanjeev, Venika, as well as Amog have got two correct. Okay, let's go to the next one. What is the concept of warm COVID-19 vaccine? Can anybody tell me what is the warm COVID-19 vaccine? Warm COVID-19 vaccine. The meaning of this warm COVID-19 vaccine, it was recently in news. What is warm COVID-19 vaccine? This is a tough question, but it was recently in news. Yes. Anybody can answer. What is the warm? It can be the tiebreaker. Warm COVID-19 vaccine. What is the concept of that? Amog is not correct. Yes, stable at 27. Amog, did you answer that? No, Ashok Woody has answered. Very nice. Stable at 27 or 30. So that is the concept which our own IISc is pioneering. they have come out with a incubate company called Minvax, which has on the job of producing a vaccine candidate that is stable at 27 to 30 degrees centigrade for COVID-19. What an amazing achievement. Yes, Amog is also correct. Okay, so I will give the prize to not only Amog, but also Venika and also Sanjay. So I have chosen three people for the gift hamper. You will have to type your address. And now I'll proceed with the next part of the, because it is also important for you to be very fast in answering. So PKM Educational Trust, established in 1993 in salubrious Bangalore, with a very dynamic chairman, Sri Raja Reddy sir, and ably assisted by Kiran sir as well as Arun sir. So they run the RR institutions, which have got RR Institute of Technology, Architecture, Nursing, and of course the Pharmacy College. So this is a bird's eye view of RR Pharmacy College, and there is also NRR hospital attached to the RR group. The courses offered here, of course, B Farm, Farm D, M Farm, and D Farm. So lush green environment, as well as highly dedicated and committed faculty members with good infrastructure awaits the students there. And we have today a very hardworking, handsome, and cheerful leader who is known to spread cheer wherever he goes. And that is our Union Minister, Mr. D.V. Sadanand Gowda, who was born in 1953, Minister of Chemicals and Fertilizers, under which the pharmaceuticals discipline comes. He represents Bangalore North constituency and has served as the 20th Chief Minister of Karnataka also. He is known to be a very dynamic and affable personality, coming from very humble background, born into a Tulu Gowda family. He graduated in science from St. Philomena's College, Puttur, and he also did his law from Udupi's Vaikunta Baliga College of Law. He was active in student politics, then became a part of the Akhil Bharatiya Vidyarthi Parishad, and he was practicing law in Sulya and Puttur. Now you may be wondering why I'm giving you a story of the Titanic. You see, when this Titanic ship took its voyage to New York from Southampton, England, it got stuck in an iceberg and around 1,500 passengers died. When the ship was sinking, they fired flares, that is to signal that they are in distress. 7 miles away, there was a ship called Samson, but that Samson ship was hunting seals illegally. So when they saw these flares, they wanted to go and help the Titanic people, but they did not go because they were doing illegal activity. They turned in the opposite direction and ran away from Titanic. There was another ship 14 miles away called Californian. Now this ship the captain thought that, listen, we can't do anything. It is too dark now. We will do something in the morning. So he was dilly-dallying and did not go for help. Another ship called Carpathia, which was actually headed in opposite direction, 58 miles away from Titanic, when it heard the distress cries over the radio, the captain of the ship knelt down and prayed for God for which direction to take, and then the ship turned around and full steam ahead to save the 700 survivors on the Titanic. So here we see three types of behaviors. One is the Carpathia, second is California, and another one is those who are doing illegal activity. So this gentleman, Mr. Sadanand Gowda, he is a very helpful personality. He will go the extra mile. He is like the Carpathia ship. He will go the extra mile to help people and ensure that he does a good job. So salute to you, sir, and thank you very much for agreeing to be here. But unfortunately, we understand that due to COVID-19 infection, you are down with that and hospitalized, so you are not able to participate in our show today. He has been with us when he talked about the Janaushadhi concept, and today we are on the concept of NPW special, that is pharmaceutical care challenges and opportunities. So now I request the dynamic principal Narayan Swamy sir, principal of RR College of Pharmacy, to kindly give the message from not only Mr. D.V. Sadanand Gowda sir, but also your message. Thank you very much. Over to Dr. Narayan Swamy sir.
Thank you, sir. Thank you, sir. A wonderful good evening for one and all. Sir, am I audible?
100%, sir. Thank you very much. Yeah. Please continue.
Thank you, sir. Thanks. A wonderful evening for one and all. on this special occasion of National Pharmacy Week, organized by RR College of Pharmacy and along with the in association Karnataka Registered Pharmacists Association Mysore. On behalf of RR institutions, I would like to welcome you all for the International E-Conference on Pharmaceutical Care Challenges and Opportunities. A warm welcome to all known dynamic and humble personality Sri D.V. Sadanagowdaji, Union Minister for Chemicals and Fertilizers and former Chief Minister of Karnataka. And I welcome you, sir, on your absentia. I heartily welcome Dr. Mahesh Burandeji, sir, Director, IPR Pune, who is an eminent academician with over 35 years of experience in the industry, spoke on various fronts of the pharmaceutical sector in India. Welcome you, sir. I also welcome the guest special invitee, Sri Sunil Chiplankar, sir, Dr. Kaushik Devraju, and our chemistry HOD, Professor R. Ravindra, sir, and all the attendees for the event. Once again, I welcome you all for this occasion. Now, thank you, sir. Now, our Sadananda Gowdaji, on his absentia, he has sent a message to all the attendees. Just I will read the same message what he has sent to our community. Greetings to all 12 lakh pharmacists on the occasion of National Pharmacy Week 2020. Pharmacists are truly the frontline corona warriors, as even during the lockdown period, pharmacists have taken risk and provided medicines, including doorstep delivery to elderly patients. It is acknowledged globally that the most accessible healthcare professional is the pharmacist. Currently, there is no lockdown, but as we all know, there is no lockdown for the COVID-19 viral fever. Hence, all should take complete precautions while doing our official duties and meeting social commitments. The premier body of pharmacy professionals is in Indian Pharmaceutical Association, IPA. The IPA was established way back in the year 1939. It has a large number base and operates through 20 state branches and 48 local branches. The members represent various facets of pharmaceutical profession, example, industry, regulatory, community, and hospital pharmacy, practices and education. As a member of Drug and Technical Advisory Board, India, IPA is actively involved in advising the government on matters of professional importance. IPA is affiliated with the international pharma associations like FIP, FAPA, CPA, AAPS, AAIPS, and is working with the international bodies such as WHO and WHPA for carrying out various collaborative professional activities that include organizing training programs for professionals from industry, academics, regulatory, and practice. The IPA has organized National Pharmacy Week NPWO celebrations right from 1962. NPWO celebrations are held every third week of November. The purpose of this activity is to take all stakeholders such as patients, healthcare professionals, state and central governments, regulators, policymakers, students, citizens of our nation to become aware about not only the presence of pharmacists, but also to know the role played by registered pharmacists with their expertise on medicines, their usage, handling, and dispensing. The theme of National Pharmacy Week in 1962 was pharmacy as a career. And in 2020, the National Pharmacy Week theme is a pharmacist frontline health professionals. This is an appropriate theme to acknowledge the stellar role played by pharmacists in the pandemic era. The pharmaceutical industry has risen to the occasion by providing medicines, including those that help patients recover from COVID-19. Further, pharmacists in hospitals and community have rendered yeoman service by providing medicines and timely consual of build confidence in community. Many pharmacists have risen to the occasion by providing excellent inputs to strengthen pharmaceutical practice and profession. For example, a book entitled Pharmaceutical Consumer Complaints, a guide to academia and pharmaceutical industry, community, and retail pharmacists, edited by Dr. Girish Pai, Dr. Muddu Krishna, and Dr. Richa, published by Manipal Universal Press, is a well accepted new contribution. The government of India too is committed to improvement of pharmaceutical profession and industry. We are proactively looking to provide industrial parks with the facilities to grow API, pharmaceutical, and nutraceutical industry. This way, Indian pharma industry will continue to play a prominent role as the pharmacy of the world. We are also encouraging innovation in pharmaceuticals and medical devices. R&D funds and other facilitating programs are focused of the Modi government, and this is helping improve pharmaceutical offerings. We are also sensitive to grievances pharmacists. We are committed to improve the lot of pharmacists. On the occasion of 59th National Pharmacy Week celebration under the guidance of IPA, a body headed by Dr. T.V. Narayana, National President, IPA, I greet all pharmacists and congratulate them for their stupendous role as a life-saver healthcare professionals. I also congratulate the team from RR College of Pharmacy and Karnataka Registered Pharmacists Association, Mysuru, for organizing this international webinar as a part of the 59th National Pharmacy Week. I extend my warm greetings to Dr. Mahesh Burande, a senior pharmacy professional and academician who shall provide the keynote address today. I congratulate Group Pharmaceuticals Bengaluru for their collaborative role to all these knowledge webinars. Thank you all. This is a message from the Sadananda Gowdaji, Central Minister and ex Chief Minister of Karnataka. He has sent me the message, the same message I just read on behalf of Sadananda Gowdaji. Thank you all.
Yes, sir. Thank you very much. I think without much further ado, I will introduce Dr. Burande Saab and hand over the session to him. So Dr. Burande Saab believes in a very lovely motto, which is live, love, and laugh. He has not only completed his MPharm PhD, but also DBM, MD, BA in marketing, LLB, and MSCIT. He is an FDA approved in tablet, capsule, and toxicity studies. He has been the president of the 69th Indian Pharmaceutical Congress, Chandigarh 2017. Sir is also the honorary director of Institute of Pharmaceutical Education and Research, which is a very important body that has helped thousands of pharmacists to improve their skill level and also get a direction in their career. And Dr. Burande Saab comes with 36 years of rich experience in pharma industry, not only as an academician and consultant, but also as a trainer. His training spans not only marketing, but also GCP, GMP, GPP, and also in positive attitude development. He has created several displays for regulatory authorities like TGA, FDA, ISO, MCC, and so on those lines. He has, through his Indian Pharmaceutical Education and Research IPR Pune, offered 23 comprehensive diplomas to interested pharmacists. He has trained 20,000 community pharmacists. He has carried out 1,000 plus training programs. He's been the vice president APTI, organizing secretary for 54th IPC Pune, chief financial officer of 59th IPC Varanasi, and you can see the kind of awards that have come his way. Doyen of Pharmacy Award 2002, Lifetime Achievement Award from the Chemist Forum, Best Alumnus Award from Kundani College, Outstanding Pharmacy Contribution Award, and so on. He is the president APTI from 2013 to 2016. He has also pioneered the Pharmacy Cup to promote the bonding through the medium of cricket. He is also attached to the public testing lab of and the manufacturing unit for Pune College of Pharmacy, which is a very interesting way in which he has approached the pharmaceutical growth. And currently is the director of IPR and professor at Dhariwal Institute of Pharmaceuticals Education and Research. So live, love, and laugh. Sir, you're on. Thank you very much for accepting our invite. and we are all yours, sir. Thank you very much.
Yeah, let me share the screen first.
Yes, sir. You can select the window, sir, for application window.
Window.
You have now shared the screen, I think the whole screen.
Go back again.
Yes.
Screen is on?
No, you are visible, so you will have to share the screen now. You can check the window and share the window. You choose application window, sir, and then share it. Not entire screen.
Okay.
Yes. Now you can go for the slideshow mode. Correct, sir. Thank you.
Thanks, Sunil, for moderating this seminar on pharmaceutical care challenges and opportunities. I'm extremely thankful to Dr. Narayan Swamy, the principal of RR College of Pharmacy, dynamic HOD of chemistry, Professor Ravindra, and also the president of Karnataka Registered Pharmacist Association of Mysore, Dr. Kaushik, and the whole team of RR College of Pharmacy and the group Pharmaceuticals for giving me this opportunity to present this topic, pharmaceutical care, which is really touched my heart right from 2000 when I visited Australia and seen how the pharmacists are working. And taking some experience from there, actually, we have developed some programs on this line. And some of the concepts which I would love to deliver today on pharmaceutical care, which are the challenges and opportunities for the Indian pharmacist at present. Coming back to the statistics, as most of you know very well, that we have more than actually 26,000 pharmaceutical companies, but the leading companies are 10,000. And actually, the listed companies growing very fast are not more than 500. And one of them is the group Pharmaceuticals, where they are sponsoring such type of activities. The brands, when we talk, more than 2 lakhs available in India, in the domestic market. And if you go to any chemist shop, today more than 7,000 to 8,000 brands are prescribed from the chemist shop, or maybe from the hospital also. The domestic turnover, which we are actually touching today to 1,30,000 crore and growing at a faster speed of almost 16% CAGR. But the potential, what we observed, that we may touch to 2,20,000 crores in next 2 to 3 years, what we are planning. Even exports of the drugs, you know, the world is dependent today on India for the quality as well as the economy of the manufacturing of the generics. Maybe tomorrow, I think the concept of vaccine, which is likely to be developed in India for COVID-19, even the new drugs will also come, which we will export. Export is presently touching to 1,40,000 crores, but it may go to 2 lakhs crores maybe in 2 to 3 years. Especially we are looking 2023, where India can become the pharma superpower. In supplying the quality medicine at the economic cost, we are really leading at present with the volume of our actually medicines which are produced in India. And looking to the systems for the developing the quality, almost more than 1,300 plants are approved by WHO. And due to this approval, we can actually supply these medicines to all the countries where WHO is applicable. But the most important aspect is, when we talk about the quality, it is US FDA, which is very stringent. And more than 1,200 plants are approved in India, including the bird drugs as well as the formulations and medical devices, which is really contributing for export as well as the use of medicine in the domestic aspect. And we are really contributing to the world in manufacturing the quality medicine. But the concern for us is giving the quality service, where the pharmaceutical care comes into the picture. And that is the area which is the gray area at present, or which is the challenging area, I can say, where all the pharmacists like you and me has to contribute in a big way. And the biosimilar market is moving rapidly. And the best example is COVID-19 vaccine. A lot of biotechnology products are coming into the market, which are going to rule the world. And the companies like Serum Institute of India, Biocon, Bharat, Zydus Cadila, Panacea Biotech, all of them are leading at present, and many of them will also emerge in the future in this area. One thing which I would love to tell you that how we have progressed, because many of you are pharmacists. I think when we became the independent, our average life was 37 years. But today, when we are talking about the average life, it is almost touching to 69.4 years. In 2017, it was 67 years. That suggests that we have produced the quality medicine, and up to certain extent, we are giving the pharmaceutical care. Investments are increasing, opportunities will be more. I think in clinical research also the openings are more, and that's why if you are looking for a big career as a pharmacist, in fact today, every day, more than 10 pharmaceutical companies are conducting the interviews for various posts. But many times what we see that the skill which is required to start the activity right from the first day in pharmaceutical organization is lacking. That we are missing. Otherwise, the jobs are available plenty. But once you are in the organization, that experience will develop the skill, and again, the contribution will be much more. One more point which I wanted to illustrate here, the doctor to patient ratio. When we talk, the ideal ratio is to 1 doctor, 1,000 patient. That means for 1,000 patient, 1 doctor should be available. But in India, look to the situation, 1,000 patient, we have 0.6 doctors available. That suggests that almost 40% area where the pharmacists, nurses, and the paramedical force has to contribute shoulder to shoulder with the doctor. This is a big opportunity in the pharmaceutical care. In COVID-19 lockdown, which are the people contributing in a big way. It is the chemist who is working in the medical shop, the doctors, hospitals, and nurses who are working in the hospital, and the pharmaceutical companies where our pharmacists are working. And that's why when we are talking about actually the contribution of the pharma, it is growing and growing, and the status which we are acquiring in the society is really respectful. We congratulate all the young students for joining the pharmacy profession at present. So role of the pharmacist in actual pharmaceutical care is a significant in the future, and that is the challenges in front of us. When we are saying that we are good in the manufacturing, but the statement which is made, which one advertisement which I saw, which I wanted to relate, good pharmacists understand drug manufacturing, which we are very actually smart at present.
Sorry to disturb, sir. Sorry to disturb. I request fellow presenters to please mute your audio. Only Dr. Burenda Saab's audio will be on. Continue, sir. Sorry.
Yeah. As I said, we are very strong in the manufacturing area at present. And that's why we make a statement that the good pharmacists understand the drug manufacturing. We are very good in this area. As we have suggested, Many plants are approved by highest actually certified regulatory bodies like USFDA or MHRA or maybe the PICS and other things. But a great pharmacist understands the patient. And we wanted to actually contribute in this area where our PharmD students in the future, we are expecting to contribute much more through the hospital as well as the chemist store in that case. And that is the area which is a concern for us, and that is the challenge which we have accepted. As the WHO said, what is the role of the pharmacist? That means it is a drug expert. He is an information provider. It is not the drug expert only in the manufacturing, but also giving the service as well as the knowledge to the patient as well as to the doctor. Counselor, I think the best actually skill every pharmacist should have, whether he's in the hospital or community pharmacy, is the counseling. Patient counseling is the highest scale, and we can be the best counselor to talk regarding the medicine, to build the confidence and provide the sympathy, and ultimately to go for the patient compliance by actually taking the medicine so that the patient can take the medicine. Patient helper at any time, whenever any question is asked, whenever any support is asked. Medication interviewer, many times we have to suggest the drug interaction to the doctor who has prescribed the product and ask him to suggest the different brand or a different medicine so that the interaction will not happen. We should work as a problem solver in the society by creating the awareness. And ultimately, our role, whether I'm running the medical store or whether actually I'm working in the hospital or whether I'm working in the pharmaceutical industry or maybe in the pharmacy college, is the health promoter. Wherever the health, and now the people have understood that having the money is not everything today. Having the health is most important, and we are proud that we are the health promoter in this country. I think I wanted to show you one video. Let's see whether we can run it. I think Sunil can help me in that case if it is running properly or not. Sunil, you are getting?
No, sir. You have to, I think, stop the screen share. Again, you have to open the application, that window, and then play the video.
Okay.
Yeah. You have to select that window.
Again, sharing.
No, you stop share first.
Yeah.
Yeah. Now you start sharing again.
Okay.
And this time you select that video in the application window. Not your PPT, but that video you can select.
Through application window.
Yes.
Okay.
Yes. Now you please play it.
It's running, I think. Okay.
It's running, but the voice is not coming. Okay. Baba Saigal. Sir, I have got this. Can I play it here from my YouTube? If
Yes.
I stop sharing, you can play. You can allow me to play it.
Okay.
Yes, I've got it. I'll play it here immediately. You stop sharing. Sir. Okay.
Yeah.
I'll play it now. Then you can.
Yeah.
निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा। निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा। घर में चिल करो एसी में, हर बीमारी की दवा है फार्मेसी में। बेबी संभल के चलो ना, जान धोकर पीछे पड़ा है ये कोरोना। अरे कोशिश है फार्मा के लोगों की, बनाते हैं दवाई लोगों के रोगों की। कोविड वॉरियर से भी ये कम नहीं, ये है तो फिर हमें कोई गम नहीं। निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा। निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा। ये फार्मा जान बचाता है लोगों की, नोबल इसके कर्मा। इंस्टा कोट से कोटिंग है इसकी प्योर, इसकी गारंटी देता है आइडियल क्योर्स। आयुर्वेदा में और एलोपैथी में भी काम करती है कोटिंग, सिंपैथी में भी। अरे फार्मा में जो भी जॉब करते हैं, हाथ जोड़ के नमन उन्हें करते हैं। एंटीबायोटिक हो या प्रोबायोटिक, करो टिक 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 टिक। निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा। निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा। निकल पड़ा है फार्मा लेकर अपना कारवा, जान बचाता है लोगों की नोबल इसके कर्मा।
Yes.
Sir, it's true.
Yeah. Thanks, Sunil, for helping me. And why I have shown this video, because saving the life, nurturing the life, protecting the life, enhancing the quality of the life is the role given to us as a pharmacist. And I think that is the meaning which WHO has given to us. And we are working on actually all these applications to contribute for the life. And that's why hats off to all of you for promoting pharmacy and working as a pharmacist in the society. Our mission is always to choose the right drug for the right patient at the right time, with the right dose, through the right route, in the right way. And all these things is covered in the patient counseling when we are doing that. And I think that is our role, and that is the role which we are doing, even manufacturing the right drug with the right actually dose, so that the quality can be actually inbuilt in a pharmaceutical product, and ultimately that service can be given so that we can save the life. That is our mission. And if you read out actually why I am a pharmacist, all the job responsibilities somebody has quoted long back. The author is not there, but I think everything what we are doing, which is written long back, maybe 500 years back, it is true today that I am a specialist in medication. As I said, more than 2 lakhs brands which we are manufacturing. And from my medical store, if I am selling almost 7,000 brands, so I must have the all technical aspect of that brand regarding the pharmacological aspect, dynamic aspect, kinetic aspect, side effects, dose, interaction, everything I should know. That much expertise I should gain when I am working as a pharmacist. I supply the medication and pharmaceuticals to those who need them. That means whenever I receive the prescription, that time only I am supplying it. Without prescription, I am not giving the medicine to anybody. I prepare and compound special dosage form. Today, it is the role played by the pharmaceutical factories. Earlier, pharmaceutical factories were not there. And that's why actually the pharmacist was a compounder. He was making the dosage form in the chemist shop itself. And that's why he's called as earlier druggist and chemist. But today, you know, everything is available from the pharmaceutical companies. And that's why that role is reduced. I control the storage and preservation of all medications in my care. That means, again, the stability of the drug is most important. And along with the stability in the manufacturing, whenever the drugs come to the drugstore, maintaining the temperature. Now, the challenge is not that much to produce the vaccine for COVID-19, but the supply chain management is the biggest task which we are going to actually face this challenge. And making actually the drug storage conditions and supplying that vaccine COVID-19 at the right time, with the right quality, with the right dose, is a challenge which we have to accept. And that is my role and that is my responsibility. And that's why maintaining this temperature, not only in my chemist shop, but also through the transportation, will be my responsibility in that case. I'm custodian of all medical information. That means any information anybody wants from my medical shop, I think I should provide it, or maybe from the hospital store. My library is a ready resource of drug knowledge. That's why whenever I get any information today, I think I should keep it in my library. It may be on my laptop, it may be in the desk, and I should actually refer that actually library to give the best actually information, maybe to the doctor many times. My files contain thousands of specific drug names and tens thousands of facts about them. And that's why the role of medical representative is most important. Whenever he's coming to the chemist shop or maybe to the hospital, many times he's giving you the literature, he's giving you the journals, and through that journals, I think many references are there. And I think keeping that and giving at the right time to the right person so that the right dose can be prescribed will be our role in that case. I'm supporting the doctor on that line. My records include the medication and health history of entire families. I must know as a chemist shop pharmacist that how many families I'm actually giving the service. That means each and every person who is taking the medicine, I have the document on that line. If you make that, I think these are the people you are serving in the Indian population and contributing for the nation in that case. We must have the document on that line so that you should be a good document manager. And my journals and meetings report advances in pharmacy from around the world. What's happened today? I am really happy today. Before starting this program, Sunil has asked you many questions. And these are the latest questions. After reading or maybe after actually coming to know that what's happening with the COVID-19 manufacturing, he has actually asked this question. And those who can answer this question, you are at par with what's happening in the pharmacy profession. And as a pharmacist working in the medical store, I think I have to keep all these happenings with me so that I can pass on the best knowledge. I am a companion of the physician. I am not the competitor for the physician. I will not actually substitute any prescription which he is writing. That means I am a companion. I can suggest to him to change, but I don't have the authority to change. And that is the companionship. When doctors will respect you, you will respect the doctor. I think that is the best combination which we can contribute in the pharmaceutical care. That is the day which we should see. I am a partner in the case of every patient who takes any kind of medication, whether actually it is taken from my medical shop or any other hospital. If anybody asks me, I should provide that information to that person. I am a consultant on the merits of different therapeutic agents. That means, you know, the therapeutic drug monitoring, which a pharmacist in the hospital is doing. But even in the OTC medicine, what is the best medicine? Even with the actually Ayurvedic medicine, which can be the best Ayurvedic medicine, especially in the COVID-19, I should highlight some of the aspects on that line. How the honey can contribute, how the turmeric can contribute, how the Chyawanprash can contribute. All these are the merits of the various different therapeutic agents. And I should contribute the right thing in that case. Not promoting the product where I have the more profit on that line. I am the connecting link between physician and the patient. That is the importance which I am contributing for the pharmaceutical care. I am the best counselor to the patient. I help the patient understand the proper use of prescription medicine. That means I do the counseling with the prescription so that he can understand that how he can take the medicine. I assist in the patient choice of non-prescription drug, where the authority is given to me, and there I can assist him, there I can suggest him, because that is my authority. And likely, I think the OTC schedule is likely to come, and that time the authority is fully given to the chemist who can contribute as a pharmacist friend in that case to the various actually society people. I advise the patient on matters of prescription storage as well as the potency. Cool temperature, cold temperature, I will explain to each and every patient so that he will not actually make any mistake when taking the medicines to the home. I am a guardian of the public health. I will create the awareness, and my suggestion is not a single person should come to my medical store. That much awareness I will create. I will be the most happiest person if nobody is purchasing the medicine from me. But you know, that situation is the real challenging one, because the new diseases are coming, new symptoms are coming. COVID-19 is the best example in that case. But I should be so much positive on that line that I think I should educate the people on that line that nobody should come to my drugstore to take the medicine. My pharmacy is a center for healthcare information, not only the medicine, but also regarding the yoga, Ayurveda, everything I will discuss with the people with my knowledge, whatever I have. I encourage and promote the sound personal health practices. My services are available all time, 24 hours working. That is the importance. My chemist shop will not work 9 to 9 p.m. It will be 24 hours because, you know, the telemedicine, actually the concept which has been started, like that the telepharmacy concept will come where a pharmacist can be contacted in that case at any time, like a doctor. At that time, I should make available myself and provide this service. This is my calling. This is my pride. Who has written, we don't know. But all these practices today, we have to actually start practicing and that is the real pharmaceutical error. And this is the challenge in front of us. This is actually the major challenge which we are facing. How much we are doing out of all these things, how much we are doing, just ask yourself, or just actually see that how many pharmacists are working on this line. And let me tell you, the pharmacists who are working on this pattern, he will have the tremendous job satisfaction, and also that medical store will be a fastest growing medical store in that area, or maybe in the hospital. Actually, the patients will prefer to go to that hospital because such type of services are given by the pharmacist. And this is the role in US, what pharmacists are doing. Healthcare workers, top earners in the US. When we are talking about the profits, when we are talking about the money, this service is given by the US pharmacists. And that's why, along with the doctors, nurses, and paramedical forces, pharmacists are the top earners in the US. And I think that is the day which we are looking for even in India. And when we are talking about the patient counseling to increase the business, yes, we are in the business. And in business, the profit is a beautiful word, but profit with actually professional service, that will be the synergism in that case. And for that synergism, patient counseling is must. Start doing the patient counseling. Make some room. Or maybe your next drugstore, you should go for the 500 square feet, 1000 square feet. Make one actually area for the patient counseling and start serving that. And it's our observation, let me tell you, since we are conducting many programs on that line, as well as the diploma certificates, I think the people who do the patient counseling in a professional way, their business increased by 30% every year. That means the profits will come, the money will come, but the most important is the respect which will come to the pharmacist in a big way with the patient counseling. Otherwise, many times we will hear such, we will actually see such type of news. Man dies after taking cancer medicine. The chemist arrested. We should be proud of such type of actually the news which are coming in the newspaper or maybe in the media. We should not. We should not allow, actually, any pharmacist should not allow that such type of, actually the news should come in the front. And what happens actually, it was a simple technical mistake that the pharmacist was not there. Only the registered pharmacist certificate was there. He was not knowing anything about the medicine. He received actually the prescription of Folitrax. The Folitrax was not there. It was out of the stock, but there was a Folimax. And this actually not educated person who is serving in the pharmacy, many times what we observed, he thought Folimax is almost Folitrax. That means the similarity is there. But he never understood what is the ingredients in that because he was not educated on that line. And that is the role of the pharmacist is important. In Folimax, we have folic acid, pyridoxine hydrochloride, methylcobalamin tablet. Now, to build the immunity, you know, doctors are prescribing today the vitamin B complex. Right? And I think the Folimax is also contributing in a big way at present. But the replacement was taken by the Folitrax because of the non-educated person. And it was a methotrexate. It was an anti-cancer drug. And if any person takes anti-cancer drug, he is not suffering from the cancer. And after the age of 60, it is a toxicity, that person died. Of course, that person was arrested, chemist was arrested, everything happened. But I think that is not role of the pharmacist. That's why I said that the role of the pharmacist, this is the challenge in the pharmaceutical care, that you can only understand what is Folimax and what is Folitrax. But one good example which I wanted to quote by one of the pharmacists, what he observed when the product came into the market, it was a Medzol, which was a pantoprazole. You know, it's the drug for the acidity, pantoprazole, and it was an injection. And another Midazolam, that is a Medzol, which was come, it was a Midazolam injection. It was a tranquilizer and anti-ulcer drug. Totally different effect. But I think that confusion may be there in the people, and anybody can give the Medzol, which is the IV drug, and many actually problems will come. But he observed that, he promoted, or he has given this information to FDA, and now one of the product has withdrawn the Medzol, actually the brand name which was given by the company, because registration is required. And that's why the registration, R means registration. Here there is no R. That means it is not registered. The title is not clear. The brand name is not clear. This is such minor observation which you have to do, and you have to report to the FDA many times, or maybe to the concerned person. That is your role, which one of our pharmacists has done. That's why I'm appreciating that pharmacist who has done this job to withdraw one of the product Medzol from the market. Otherwise, many times, you know, people are making the joke that one of the actually the cartoonist has actually made actually this cartoon on the pharmacist. The boy is asking the father that when we go to the temple, there is actually, when we go to the chemist shop, there is no actually pharmacist. only the certificate is there. So he's asking that when we actually, why, father, such type of actually situation is there. When we go to the medical shop, there is only the certificate of pharmacy. And father was unable to answer. And father said that in the temple, you see only the God's idol, but not the real God. That means the real God is a pharmacist. But unless or until the real God is not sitting in the pharmacy shop, I think you cannot save the life. It is said that the super mighty save the life. You are the super mighty. And sitting in the chemist shop, sitting in the hospital store is your responsibility in that case. And each and every medicine which is dispensed from your medical store, it should be supervised by you. That is the commitment which we want. That is the challenge which you should accept and contribute in this big way. You may be a pharmacist, you can appoint other pharmacists, registered pharmacists, train them properly, but at least one pharmacist should be there when the drugstore is open. Otherwise, such type of cartons will come and they will actually bring our profession down in that case. And we are looking to promote the pharmacy profession in big way. That's why we always say, if you are a pharmacist, I think the positive attitude, Sakaratmak Drishtikon, is the first individual character which you should build. That always think positive as far as your profession is considered, your role responsibility is considered. You should have the product knowledge, whatever you are selling. Product knowledge is required to work even in the sales and marketing also, in the manufacturing also. But even in the chemist shop, I think the product knowledge is most important so that you can do the better counseling. Patient knowledge is also important. Many times the patient is actually giving you so many problems which he is suffering. And from that problem, you can suggest the best OTC medicine, or you can actually suggest the best prescription drug, consult with the doctor, and that is the best remedy in that case. Listening is the highest skill in the life. And so listen to the patient. They are actually having tremendous trouble. They are actually suffering from the pain. So listen to them. That is important. And that is the pharmaceutical care which we are talking about, that take the care. Like a mother takes the care of the child, you take the care of a patient and become a mother of a patient. Patient care is important. Here afterwards, that is the real challenge. Counseling is the skill which you have to demonstrate. A lot of actually activities we are doing today on this line. Prescription review, identifying actually the drug-drug interaction, because many times in the prescription, 7 to 8 medicines are written. And I think it is your role to screen that prescription for the drug-drug interaction and suggest the doctor. First time he may neglect, but later definitely actually the confidence will be built that doctor will always suggest that go to that medical store. He will actually give you the best medicine. And if any mistake has happened, that pharmacist will observe that. And again, the patient can come back to me. That is the confidence which you have to build. Prescription review. And today also the packaging knowledge, because a lot of actually sophisticated packages are coming. How to open the package, how to keep the actually drug again back to the package will be important. How to protect from the actually environment by offering the best package, that will be the role of the pharmacist. So all this role you have to perform as a pharmacist, then you are called as a true pharmacist in the society, and that is the pharmaceutical care. But not a single P. All these are the P's in the pharmacist in the P. If you are not actually exercising any P as a pharmacist, then the spelling of pharmacist, you always say, become pharmacist. That means what we are passing on? We are passing on the side effects, adverse effect, drug interaction, drug food toxicity, drug-induced diseases, addiction. And that is not our role. Saving the life is our role. Killing somebody's life is not our role. That role is given to somebody by the God. We should not do that job. And that's why answer to avoid this, become a professional pharmacist, become a positive pharmacist, become a pharmacist actually who can take the care. And that's why a pharmaceutical care pharmacist you should become. And we are sacrificing our life, but contributing. It's a beautiful story of Neha Shauri. She is no more working as an assistant drug controller of Punjab. She has been shot dead by one of the person, actually, where she has actually cancelled the license of that person because the malpractices he was doing. Taking the revenge after 1 or 2 years, I think that person came to the office and shot dead Neha Shauri. But Neha Shauri sacrificed her life, but she have protected so many people from the Punjab. And that's why salute to Neha Shauri. We always say that the soldiers are protecting the country. Even the pharmacists are also protecting our country. Saving the life is the protection in that case. Saving the country is the responsibility. And saving the country because of the pharmaceutical care is the role which we are performing. Neha Shauri has done that. Many pharmacists working in the medical store as well as the hospitals are also doing the same thing, which you should continue on that line. And one of the pharmacists who was always coming with me, he's no more. He died because of the cancer. Mr. Verde, marketing manager of New Life Pharmaceutical. And when he actually passed from the hospital, he called me that day and he said, Dr. Burande, whenever you promote pharmacy profession, especially the pharmaceutical care, read this actually poem, which will inspire the pharmacists. So I'm reading for you. Dear pharmacists, wherever you may go, this world or the other, there is always a place for you. Where life prevails, melodies also do. And where melodies prevail, medicines also follow with you. Health depends on you. And on you depend the nation's health too. On health depends the nation's growth. On health depends the nation's strength. On health depends the nation's wealth. And therefore, on you depend the nation too. All this to tell you how important are you. Remember all this and remain always to your pharmacy profession honest and true. What a beautiful message Mr. Verde has given to all of us, that how your role and responsibility in pharmaceutical care is important in building the health of the nation. Friends, we are contributing, as Sunil has said, for development of the skill in the pharmacy professional, especially for the community pharmacists and the hospital pharmacists. We have many programs: diploma in pharmaceutical wholesale and drugstore management, diploma in hospital materials management and financial control for hospital pharmacists, advanced diploma in clinical research and data management, ADCR-DM, and master's diploma in pharmaceutical management by doing any 3 programs, and even advanced diploma in community pharmacy management. Those who are interested, you can go to our website and take the advantage of that, because development of the skill is most important, and we are contributing through Sarvada Vigyata Vijaya, that means skill always wins. So thank you very much, Sunil, as well as the Ravindra and all the team of Group Pharmaceuticals for giving me this platform and the opportunity to inspire you to celebrate the Pharmacy Week in a big way. Thanks a lot.
Thank you very, very much. That was, as usual, masterful oratory and spellbinding effect you had on us, Dr. Burande Saab. You're really a God-blessed person, because you speak so well, and that captures our attention and we get mesmerized when you talk. The impression is very powerful when you talk. So, Dr. Burande Saab, I would like to know that, see, this trend of pharmaceutical care has started probably increasing recently. That is, earlier they were mainly compounding and selling, but today there is a lot of focus on retail, wholesale, community pharmacists, clinical pharmacists to do some pharmaceutical care, which includes the counseling, etc. So how do you think pharmaceutical company marketing professionals and marketing people, how should they align with this new trend? Can you please enlighten us on that?
See, our role and responsibility as a marketing person is no doubt to meet the doctor who is a prescriber. That is our prime responsibility. But while actually passing on this knowledge to the doctor, we have to pass on the same knowledge to our chemist as well as to the wholesaler. Why I'm saying wholesaler today, earlier it was not that much role. But today the products which are coming, especially in the cold chain, when we are talking about the vaccine, understanding the technological aspect of the product is important, so that we can make the product more stable and it can contribute ultimately through the supply chain management. So giving the highlights of our product as far as the storage conditions are considered, even how our ingredients are working, because as I said, the patient counseling is the role of a actually pharmacist even in the chemist shop. So that whenever any prescription is written, if that prescription belongs to your company, suppose Group Pharmaceutical, in that case, if you detail the product to the chemist, even that chemist can detail the same highlights of the product to that actually the patient. And that's why taking out some time in a busy schedule of the chemist, but explaining your product will be more important in that case, related to your product and even to the related to the happenings what pharmacy world today what you are doing. So I think that is the role which we have to play even as a marketing person.
Super, sir. So that's a new dimension, not only detailing to the doctor, but also detailing to the pharmacist. Earlier, we used to say just tell about the scheme or you tell about the price. But now it is going one step ahead. That is really great. Sir, I'll ask 2 questions more, please. One is from Dr. Subhash, who is asked, I mean, it's a little complex sounding. See, currently there is the Atma Nirbhar scheme which is on. So do you see any challenge there related to pharmaceutical care? I mean, something like that he has asked. Under the Atmanirbhar scheme. Yes, please, sir.
Yes. See, Atmanirbharta means you have to bring out your own idea and start practicing that. For example, if you are having a good knowledge and if you are really wanted to contribute to the pharmaceutical care means the first skill which is important is the counseling. In that case, if you develop as a good actually counselor, you can actually go to any leading chemist shop and say that give me some area, I will do the counseling of the product which are sold from your medical store. Don't pay me at present. When you say this, he may give you the opportunity. If you ask the money first, it will not come because you are reducing his profit. But once his profit will start increasing through the sales, he can offer you some actually money because of your skill. And later, that skill will develop in such a way that you can have your own medical store later. And even later, you can be a specific consultant on the counseling also. That means you can practice as a counselor in that case, that let people take any medicine from any medical store, but related to that product, how they should take, how they should actually avoid the drug interaction, what are the actually chances if he missed the dose, everything you actually pay, every information if you give, I think the people after some time will pay you 100 rupees for your counseling. That officially you can charge as a pharmacist in that case without even having the medical store.
Super, sir. I think that is a tremendous idea.
That is the Atmanirbharta in the pharmaceutical care. That is the Atmanirbharta.
Correct, sir. That is the blueprint, and that is the way for us to go ahead. There are a lot of questions. Last, as I said, one question I'll ask. Sir, these nutraceuticals have now become very powerful in the market. It is not like earlier times. It is now really become very professional, and I think pharmacists have got an opportunity here, not only in manufacturing, but like you said, in counseling. Can you elaborate your thoughts on this? Because I know you are always there at the cutting edge of our profession. Please, sir.
Nutraceutical, simple. Yesterday, one of my friend was discussing with me the simple thing, honey, and the latest research suggested that honey is the best product where bacteria will not grow. That is the research which was published recently. So anything related to the honey, any product related to the honey, if you can explain anybody that how honey is important for building the immunity. Now take the example of turmeric. Again, one example he has quoted me. Turmeric, if you mix with the honey, it will be the best immunity booster in that case. Antibacterial as well as actually providing you the immunity and useful for the diabetic purpose also. Because honey is the natural source as far as the sugar is considered. So anything which you will come out with such idea, many times you may not have your own product. But those who are having the product, if you come out with your technical data and actually suggest them how you can position the pharmaceutical product, the nutraceuticals will come. Anything which will build the immunity today, naturally, that is preferred by the people. And I think all these things will contribute. Take the example of kadhas, right? Nowadays, even in my bungalow, whatever the plants we have, every morning after my morning walk, I am plucking the actually leaves, making the own extract and taking that actually kada or the extract. I don't know how much immunity is built, but I am actually thinking that my energy is doubling. And so far, the COVID has not affected me. I can conduct my program. So I think something is working on that line, which you can promote in a big way. Later, you can convert into the product. And ultimately, what is product? Product is an idea. If any idea you come and start practicing it, it will be the miracle in that case. But you have to believe in that idea. You have to practice that idea. You have to pass on the knowledge. You have to generate the knowledge. You have to take out the references and actually keep your idea growing. That is the important. Don't give up anytime in the life. Everything will pay back to you. Give the world best you have, the best will come back to you. So love your profession. Have that positive attitude. That is important.
Burande sir, this is Kaushik here. So a lot of talks are going about the Atmanirbhar Bharat and digital India. Yeah. And one is lot of retailers are facing this issue. There are a lot of resistance that is building towards the digital India from the pharmacy field, like pharmacists. Two or three things that they can adopt and move forward. What are the suggestions that you like to give to them, sir?
They are afraid because online pharmacies are likely to increase. But let me tell you, 2 days back only I was discussing with one of my chemist friend how he can actually tackle all these things. I asked him whether, as I actually commented during my presentation also, whenever you are running the medical store, whether you have your contact list with mobile numbers and emails. If you are not having, that means the professionalism you are missing. You must know your customer. And once you know your customer, I think digitalization, you can start from your own medical store. You can have your own app, or maybe you can pass on some messages every morning with some product, that how this product is contributing at present. I think that will give them the information. Like WhatsApp group we make, you make a WhatsApp group through your actually chemist shop, because you have all the contacts of the people who are coming to your medical store and purchasing the medicine from you. And once you have one-to-one contact with all these medias and everything, and then helping them to solve their problem, boosting their confidence with digital media, let any big player comes, I think you can actually grow in your area, your market. Nobody is going to snatch in that case. So that is the Atmanirbharta in digitalization, what you can do, which is available for you at a less cost, and you can actually play on to that. So I think that is the best thing, because bigger players will always come. Amazon will come, then even Reliance will also come, because it's a big market. As I told you, from 1,30,000 crore, it will shoot to 2,20,000 crore. One day, 3 lakhs crore. So big players will come. But if a small player is there with his technology, whatever he wanted to utilize for his area, he don't want to distribute the drugs to the world in that case. Only in his territory he wanted to distribute. If you go for digitalization in that area, I think one day they will have the contract with this person, and I think they will supply the medicine. Amazon will supply the medicine through your medical store only. That is the suggestion I wanted to give.
Thank you, sir.
Brilliant question, Dr. Kaushik, and very, very thrilling answer by Dr. Burande Saab.
Thank you. Thank
Because that actually roamte khade ho jate na, like, you get so excited listening to these words of hope, inspiration, and actual blueprint on how to go ahead. Because that's exactly what's missing today. And today's webinar has very nicely represented that.
Thank
Well,
you.
telepharmacy is also doing a lot of, benefit to pharmacists. What do you feel, sir, going ahead?
Yes, actually, we are not doing that much counseling at present. That's why the telemedicines and again the cost, the service again. Now during lockdown period, if your chemist shop has sent the message that don't worry, any medicine I am going to supply to your home. I have this service available. Why people will go to telemedicine? What is telemedicine? The same. They want the service at their actually door. I think the same service you can utilize through your chemist shop only. And I think the service, if they are professional, I think that is the market which they are catching in that case. But along with that, it's not a food item like a Swiggy, right? It's a medical profession where if the dose is increased, there is going to lead to the toxicity. If the food is increased, there may be only diarrhea or dysentery. But if the drug is increased, you know that what anti-cancer drug has done. I think that's why counseling the patient, you have to clarify all these things so that he will not go directly for the online pharmacy where such type of services one-to-one is not available.
Super, sir. Super. There are a lot of questions, but time is again a constraint.
Yeah.
We have dealt with tremendously, and Dr. Burande Saab has been generous with his time and his inspiring ideas. Thank you so much. Now, I want to know if Dr. Ravindra sir is there, because he said he will join through audio. Dr. Ravindra sir, are you there through audio? Dr. Sir, can you please stop the screen sharing? Because then I can start the last closing part.
Yes, sure.
Yeah, okay. So that was actually the Q&A session which we just had. Just a flash here to represent that we have completed that portion also. Tremendous.
Yeah.
Now, Dr. Ravindra sir, are you there? Hello? No, I don't think Dr. Ravindra sir is there. So, well, Dr. Ravindra sir, he has been the prime mover of today's proceedings. Like you say, he's been the background player and he has ensured that a lot of things have happened because of him. Really nice, wonderful person, so dedicated to the field of pharmacy, who has successfully authored a book also called Vivavosi, which is consulted by so many pharmacy institutions. He is there in the IPA. He is there in the Karnataka State Pharmacy Council. He is an educational consultant. And he is a great believer in helping people. He has donated blood 27 times. And he has himself conducted blood donation camps. Around 30 of them have been done. So that is Professor Ravindra who wanted to highlight that the RR College of Pharmacy extends its warm greetings on the occasion of NPW, where we are representing that pharmacists are the frontline healthcare professionals. And India, which is a leading country in the pharma sector across the world, we are supplying the generics to the world. Yes, the COVID-19 challenge is there, but we are definitely pulling up our socks, and pharmacists have risen up to the occasion to provide the various drugs to the doorstep of elderly subjects too. That's how the neighborhood pharmacists have worked. And today, a lot of work has been done by the government of India, which includes developing the global supply chain, and we have to be good players in the ecosystem. We have also got a lot of innovation and R&D scope. Then lockdown restrictions are there, but they are getting relaxed. Maybe in places like Delhi, it is not relaxed. The deadly virus is still there. There is no lockdown for the deadly virus. So requesting all the viewers to take care and that they should not venture out unnecessarily. And Professor Ravindra sir, thanks all the individuals, particularly Dr. Mahesh Burande sir, who has kindly consented and come down through online all the way from Bombay to be a part of us. So now I request our affable personality, our loving individual. So Dr. Kaushik Devraju sir, the stage is yours.
First of all, let me thank all the attenders for attending on this day, joining a webinar. During this COVID period, we have learned a lot of things, and one of the best thing that I've spent my time, watching Mahabharata. Now, whenever Mahabharata scene comes, I always relate, Dronacharya to Burande sir, because that much of knowledge that he shares, and he always giving a tips. This is how we should improve, keep on improving, and these are the aspects that we should look into it. And these are the new, and every time, whenever the question is asked, always comes up with new ideas and gives a good right direction. I think thank you very much, sir, for coming and joining here and answering, being so lively, and explaining all the happening things and answering all the Q&A with fantastic answers. Thank you very much for coming and joining here. Though our cabinet minister did not join, but only one thing, we have 28 cabinet minister, but the one of the minister who smiles a lot and does it better with this lot of hope goes is Sadan Godaji. We wish you that speedy recovery for you, sir. The country needs people like you, so that we can proceed further with the greater hopes. And as you said, pharma is one thing that that's going to give a lot of revenue, and a lot of business are going to happen, a lot of export things going to happen. Thank you very much, sir, for and especially thanks to the principal of RR College of Pharmacy. Sir was sipping the tea. It's okay, it's always good to have sip the tea in middle. We would like to join some meeting where we can also sip together the tea and enjoy and share the knowledge of RR College as well as the KRPA. The bonding has increased every time they join with us. Thank you, Narayan Swami sir, and our good old friend Ravindra sir. It's always nice to collaborate with you. And you are the one of those person always picks up a call and calls me. These are not going well. You call this mayor, you call this IAS person and the bureaucrats, and always get the things done, and with a lot of right approach. I think that is where you always stand out with compared to others. Thank you, Ravindra sir, and every time you inspire us to do a lot of things. And recently I came with a app called as Saloon Guru. What it does is that it helps to find the nearby saloons, and we also have with us Sunil Chuplinkar sir, who helps us in finding the eminent person in pharmacy and comes with a lot of energy and helps us to give good service. I think that is where I like Sunil sir. I think one of the comment yesterday, Sunil sir name should be changed into Webinarkar. Thank you, Sunil sir, and to all the viewers, if you have anything to share, please write to us, and anything you want in particular, I think we can pass it to Burande sir if your question is not answered. Thank you, one and all. Over to Sunil sir once again.
Yeah. Thank you very much, Dr. Burande sir. Once again, namaskar. Really, thank you. It was rocking speech.
Thank you.
Thanks a lot. I take the permission of everybody to close this webinar. Can I?
Thank you. Have a great evening.